Some facts about the COVID-19. The coronavirus is a new coronavirus that has not been previously identified. The virus causing the coronavirus disease 2019 is not the same as the coronaviruses that commonly circulate around other humans and caused by mild illnesses like the common cold. Coronaviruses are a large family of viruses that are common in people and many different species of animals, including camels, cattle, cats, and bats. Rarely, animal coronaviruses can infect people and then spread between people. This occurred with, it went to the next slide.
Go back one on your arrow. Is it Friday or Monday?
You just need to finish that one.
Hold on. You're there?
Mm-hmm.
Okay.
So sorry about that. So this occurred with the MERS, COVID, and the SARS, and now with the virus is called the COVID-19. Protect yourself. Know how it spreads. The best way to prevent the illness is to avoid being exposed to the virus. The virus is thought to spread mainly from person to person between people who are in close contact with one another within 6 feet. Through respiratory droplets produced with an infected person's cough, sneezes, or talks. These droplets can land in the mouths of or noses of people who are nearby or possibly to be inhaled into the lungs. Some recent studies have suggested that COVID-19 may be spread by people who are not showing symptoms. Steps that everybody should take. Wash your hands often. Wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact. Avoid close contact with people who are sick, even inside your home. If possible, maintain 6 feet between the person who is sick and other household members. Put distance between yourself and other people outside of your home. Remember that some people without symptoms may be able to spread the virus. Stay at least 6 feet, about 2 arms length from one another. Do not gather in groups. Stay out of crowded places and avoid mass gatherings. Keeping distance from others is especially important for people who are at higher risk of getting sick. Cover your mouth and nose with a cloth face cover around others. You can spread COVID-19 to others even if you do not feel sick. All employees working outside of their homes are required to wear a face covering in accordance with public health guidelines. Cloth face coverings should not be placed on young children under the age of 2 or anyone who is having trouble breathing, unconscious, or incapacitated, or otherwise unable to remove the mask without assistance. The cloth face cover is meant to protect other people in case you are infected. Continue to keep at least 6 feet between yourself and others. The cloth face cover is not a substitute for social distancing. Exceptions to the face covering rule. Face coverings may be removed when employees are working alone in a single office with the door closed, in a vehicle that will be used exclusively by the driver, eating or drinking, working alone outside in an area where it is unlikely that others will come within 15 feet. Cover coughs and sneezes. If you are in a private setting and do not have on your cloth face covering, remember to always cover your mouth and nose with a tissue when you cough or sneeze or use the inside of your elbow. Throw used tissues in the trash. Immediately wash your hands with soap and water for at least 20 seconds. If soap and water are not readily available, clean your hands with a hand sanitizer that contains at least 60% alcohol. Clean and disinfect. CDC, EPA cleaning and disinfecting guidance. Clean and disinfect frequently touched areas daily. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. If surfaces are dirty, clean them. Use soap and water prior to disinfection. The Healthy School Act requires additional training for all school employees using disinfectants. Maintenance and operations will supply materials for disinfecting workstations. Symptom screening. Screen yourself for symptoms. If you're planning on visiting one of our work sites, you should screen yourself at home. Check your temperature. If it's above 100 degrees and you have symptoms, if you have a fever or symptoms, you should stay home and contact your supervisor. An online screening process is in development. Watch for symptoms. People with COVID-19 have had a wide range of symptoms reported, ranging from mild symptoms to severe. Sometimes may appear 2 to 14 days after exposure to the virus. People with these symptoms may have COVID-19. Cough, shortness of breath, difficulty breathing, fever, chills, muscle pain, sore throat, new loss of taste or smell. This list is not all possible symptoms. Others less common symptoms have been reported, including GI symptoms like nausea, vomiting, and diarrhea. Screening questionnaire. The questionnaire has 2 questions. Do you have any of the following symptoms? Fever, cough, shortness of breath, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. The second question is, have you or someone in your household had close contact with a suspected or known COVID-19 patient, or spent longer than 15 minutes within 6 feet of someone who was sick with a fever and cough? When to seek emergency medical attention. Look for emergency warning signs for COVID-19. If someone is showing any of these signs, seek emergency medical care immediately. Trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, bluish lips or face. This is a list of not all possible symptoms. Please call your medical provider for any other symptoms that are severe or concerning to you. Call 911 or call ahead to your local emergency facility. Notify the operator that you are seeking care for someone who has or may have COVID. We now have a vaccine. The clinical trials suggest that for the Moderna vaccine, it's 94.1% effective. The Pfizer is 95% effective, and the Johnson & Johnson 66.3% effective. A few recent updates are March 15th, the health officer updated for the Imperial County. What was important here for us is that individuals who are considered fully vaccinated 2 weeks after receiving the second dose of a 2-dose vaccination series, or 2 weeks after receiving 1 dose of the single-dose vaccine, which is the Johnson & Johnson. March 19th, the CDC is updating K-12 school guidance to reflect the latest science on physical distance between students in classrooms. The CDC now recommends that with universal masking, students should maintain a distance of at least 3 feet in the classroom setting. Brawley Elementary will be following a distance of 4 feet for social distancing in the classroom. Thank you, and this concludes my presentation on COVID-19.
I didn't get a chance to greet everybody, but I did want to take a moment and just say thank you everybody for being here. We're so excited to be able to move on with our venture. April 12th is coming very, very quickly. What I want to assure everybody of is that we're taking steps to try to make sure that everyone is protected as possible, and today is one of those steps. We do have machines to monitor the temperature of students as they enter campus. We've increased the hours that campuses will be disinfected every day, or that cleaning crews will be present and so forth. So I want to reassure everybody that we're taking many steps in order to try to make sure everybody stays as healthy as possible. And we certainly, want to make that happen. And we want to just thank Allison, first of all, for an extraordinary job that she's done. She's put months of work into this. There's been processes of having to report to the county and know what that process is like. There's contact tracing, reporting, just a lot of work that has gone into preparing us for this moment. And Allison's really stepped up and had done an incredible job of making sure that we've been prepared for this moment. So, if you have the opportunity to thank Allison for her work, we certainly want to, extend that to her, not just from me, but if you have the opportunity to share that with her, it's certainly that something I'd certainly appreciate you doing as well. Like I said, April 12th is coming. We got spring break coming up. So, many of you will be able to take a little bit of time off. And then as soon as that time's off, we'll fire up. Question did come to me earlier today about being able to prepare for spring break. So I did ask Mr. Dickerson to have campuses open from 8 a.m. till 3 p.m. During the week of spring break. So if there's anyone who wants to spend time in their classroom, the campus will be available during that time period. The question came up about microwaves and fridges, and I don't quite have the answer on that one yet, but I am working on it. And I do want to let everyone know that I'm looking into it. But as soon as I have a good answer, I will share that with everybody. I would like to get us there. I just want to make sure that there's some things I want to check on first. But I do understand from the standpoint of not congregating that we would like to use those things. If the answer ends up being yes, the thing I have to emphasize is that that will be for this defined short period of time where we're asking people not to congregate. Once that time period is over, of course, we would return to our normal routines and so forth. Those are just some of the quick updates that have come my way that I wanted to share with everybody. But again, we're ramping up for it. I think we're going to be in good shape. We've got some good resources in place. We've got PPE ready for staff and students. We've got disinfecting going on. Like I said, we've got extra custodial attention going to the campuses and so forth. So my sense is that we'll be ready for this. And so we're excited for that. We're excited to see students with us again. So with that, I just want to share with everybody that, like I said, we're excited and I believe we're as ready as we can be. So I'm going to go ahead and wrap up there. And again, thank Allison for her great work and go from there. So Jenna, if you're ready to wrap things up, I'm ready to wrap them up.
Okay, we're gonna wrap it up, and I love all the questions in the chat. I'm gonna be printing them out, and I'm gonna answer them all individually, and we'll send them out so everyone can see the questions and answers, so everybody will have an answer to their question. Thank you. Have a good afternoon. Bye.
Thank you, everybody.